Good evening. Good evening. This is a day of celebration. Let's make some noise. Come on. You guys can sit if you want. You don't have to stand all day. Yeah, this is a great day. You have no idea what these men and women have been through for the past 16, 17 months, right? 18 months. Come on. Who's really? We had some breaks in there. So this is a glorious day for all of us. As educators, this day represents the sharing of our knowledge, skills, and attitudes for the profession. For these guys and women, this day is like 696 clinical hours, 565 days, I don't know, probably like 19 assessments or something like that, a few checkoffs, skills in the lab, and lots of tears. Probably lots of tears, joy, frustration, right? But today these guys took a test. They took a test that's called the Comprehensive Predictor, and it's a predictive exam that tells you your likelihood of passing the NCLEX on the first attempt. Most alumni that I speak to afterwards, they say this test was way harder than our licensing exam, way harder. So you guys absolutely shredded it. Shredded it. So, kind of like Eileen Goose shredded the half pipe, these guys owned this test today. So when you're done here, you can go down to the Board of Nursing and just give me the license, because I own the NCLEX. You guys really did. You did an amazing job, so congratulations. That's absolutely phenomenal. Phenomenal work. So this has been a long journey, but let it not be the end of a journey, right? So nursing is all about lifelong learning. You'll have new patient experiences, new things to learn, continuing education. You might want to go back to graduate school. If it happens to be a nurse practitioner, I'd hope you think of Roseman again. If you want to be a CRNA, hopefully you'll think of Roseman again. Please. But it's a great thing, right? Nursing is wonderful. You're no longer student nurses today. Today you get to say, I'm graduate nurse. I'm a graduate nurse. And pretty soon here, you'll be calling yourself registered nurses. And I'm pleased to welcome you all here this evening for this celebration. And with that, I'm going to introduce people who are here making this happen. Excuse me. Up on the stage here, we have the Chancellor of the South Jordan campus, Mr. Jeremy Wells. Stand and say hello.
Good evening. So thrilled that you're here. I was able to meet a few of you. I think my fourth row friends right there from California. And so glad that you made the trip. I know that there are a lot of you from California. As I was meeting with some of the students, the farthest away that they came was from Montana, California, Washington. Any farther than that? Michigan? Did family come from Michigan? That's fabulous. So glad that you're here. 2 of you? 3 of you? 2. That's great. So I've spent some time. I'm coming from Tennessee. I've been here 6 months. Prior to Tennessee, I was in Florida. Prior to Florida, I was in Iowa. There's a point to this. Prior to Iowa, I was from Ohio. And for those of you who know, there's great rivalry between Ohio and Michigan. But I went to Ohio State for some of my grad work. I'm not a nurse, but I have a profound respect for the nursing profession. Right here, again, fourth row, one of the parents, 2 of the parents were nurses, right? 2, both of you were nurses, and daughter is following in footsteps. And that's usually the case. How many nurses do we have out here? Just by raise of hands. Nurses. So few. Oh, I see you. Yes. Thank you. Thank you. What a marvelous profession. That's a service-oriented profession, a mission-oriented profession. What a great profession to be involved with. I have a story tonight, if I may, and then I'll leave. The story is about a woman by the name of Florence Chadwick. And I apologize if you've heard this story before, but I just really like it. Florence Chadwick, she was a distance swimmer. And so she actually would swim for fun between the English Channel, France and England. And at the time, she was the world record holder in terms of time. And she swam at both directions, so she was quite a swimmer. Then she decided to swim between Catalina Island and the coast of California, which is a distance of 26 miles. I imagine there are some marathon runners out there. I'm not one. I'm always impressed that you can actually run for 26 miles, but I can't even imagine swimming for 26 miles. But that's what she decided to do. So she sets out. She's flanked by 2 boats. Those boats are there looking for sharks, and of course, if she needs medical help, her mother is in one of the boats. And she proceeds to swim for 15 hours, at which point there's some fog that rolls in, and she looks up in the boat, and she goes, I can go no further. And so they have to pull her out of the boat, and they then take her just that 1 mile to the shore. And the reporters are there, and they ask her, what happened? You were so close. And this is a direct quote. She said, I was licked by the fog, or I was beaten by the fog, which I think is a really interesting thing to say. So for some reason, not being able to see that goal prevented her from achieving that goal. So she decides to do it again. I'm not exactly sure the time frame, but she sets out again. This time, thick fog rolls in. But she was successful. She swam all 26 miles. And so the reporter then asks her, well, what was different this time? We had thick fog, and she says, well, I just kept a mental image of the shore in my mind, and when I wanted to give up, I thought of that. It's a great story, and I think about my own life and the goals that I have. I think about your lives and the goals that you have, and this is a step to a goal. I don't think it's the end goal, just graduating. It's a step to a goal that you have. My guess is that you want a profession that is meaningful, that can help you provide for your family, that can help you serve your community and others. And I hope you don't lose sight of that goal when fog rolls in, as it always tends to do. And I hope that you'll push through and that you'll have fabulous and successful and meaningful careers. Congratulations. I'm so thrilled for you. I'm so grateful that all of you came to support. They need that support. They needed it, didn't they, during those difficult 18 months. So grateful that you're here as well. Grateful that you came to Roseman, and congratulations. Thank you.
All right, and now I'd like to introduce more people behind the scenes that make this all happen. We have Dr. Susanna Winslow, the Associate Dean of Academic and Student Affairs. Professor Stephanie Smith, Assistant Director of Clinical Resources. Professor Todd Allen. Professor Kathy Barber, their faculty advisor. Professor Katie Dobson. Professor Luisa Echeverria. Dr. Courtney Gormas. Professor Bethany Hayward. Dr. Jessica Powell. Professor Jamie York. Professor Victor Venegas. And over here we have Miss Amy Siemens from our admissions. Mrs. Alina Nan from admissions. This is Stephanie Barahona from admissions. And thank you to Cambry Goodfellow, administrative assistant, and Miss Lenita Gilreath, admissions. And somewhere around here is Miss Wendy Nichols, who helps put this thing on. Oh, there she is, hiding over there behind the pinners. And don't forget to thank those who will be putting this on digital film for us. Miss Loretta and Mr. Ryan over here. And let's give a hand to Jason Gibson, who's putting this out on YouTube, making me look silly in perpetuity. And thank you to all our student volunteers who came and helped put this on as well. Your day soon. And with that, I'm going to now invite to the stage the student speaker, Miss Scout Andrew Chow.
Okay. Professors, parents, faculty, and students of the BSN 2022 cohort, good evening. My name is Scout Andrew Chow, and I have the honor of being nominated as the class speaker. I would like to start tonight on a note of gratitude. Surviving Roseman's accelerated BSN program is one of the greatest challenges I have ever faced, and I would not have been able to do it without the people in this room. I need to start by thanking my parents to be resilient and independent. To my team, thank you for all your hard work. I could not imagine surviving this experience without our endless study dates or our test day traditions. On behalf of my cohort, I would like to thank each professor here at Roseman. There are so many professors who go above and beyond in every sense, even when we were in their classroom. I hope you know how much we all appreciate you. And finally, to my loving husband, thank you for being my rock, my source of financial support, and the positive energy I need at the end of every tough day. When I look back at the past 18 months, it feels surreal to be here today. When I was little, my dad used to jokingly tell me how he would have to walk uphill both ways to get to school. He would talk about the massive amounts of snow, the holes in his shoes, and the wolves that would chase him as well. Well, when I tell my kids about the 18 months straight of classes, clinical shifts, and exam days we went through, all in the middle of a global pandemic, I'm not sure they'll believe some of my stories either. I will never forget all the times my classmates and I gathered together and practiced sterile dressing changes with a phone charger, started an IV on a banana, or inserted a Foley catheter into a shampoo bottle. Virtual learning has never been so interactive. Again, for the 100th time, I need to apologize to my husband for the time he walked in while I was watching enema training videos. I know I may sound repetitive, but I am so proud of everyone in this room. We have truly overcome so much. Between the endless late-night study sessions, managing both virtual and in-person clinicals, and many of us actually fighting COVID at some point, there's a lot to be proud of. That being said, we are entering the workforce at one of the most difficult times to be a nurse. We will need the strength and resilience that we have developed over the past year and a half to provide the patient care that is needed during these times. I cannot thank Roseman enough for making sure I had the skills, training, and abilities to become the best possible nurse I can be. I will leave you with this. As nurses, it is our responsibility to take care of people during what might be one of the worst days of their lives. This can be a thankless job, and there will be plenty of challenges ahead. If you are seated in this room today, it's because you have shown you are worthy of these responsibilities and you are ready for the difficulties that are ahead. Thank you for all of your help, and I cannot wait to see all the amazing things you all will accomplish.
In the 11th century, various members of military and religious orders who cared for sick and wounded crusaders were honored with badges. In the 1860s, Florence Nightingale devoted herself to caring for casualties of the Crimean War. In recognition of her service, she was awarded the Cross of St. George. Florence then extended the honor by presenting a Medal of Excellence to the most deserving nurse graduates at the Nightingale School of Nursing in London. Today, nursing schools around the world give a nursing pin to represent a Medal of Excellence to their student nurses upon graduation. Each School of Nursing pin has its own distinct design, which represents the symbols, colors, and phrases that illustrate the mission and the philosophy of the school. The Roseman Nursing pin is designed in the university colors of burgundy and silver. The shape of the pin symbolizes the unique block curriculum of the Roseman program. Each side of the pin represents the College of Nursing core values: service, integrity, innovation, and knowledge. The lamp of knowledge on the lower half of the pin signifies the nurse's science-based knowledge and commitment to lifelong learning, which are foundational principles of professional nursing practice. The lamp's bright flame honors those who, like Florence Nightingale, strive to light the way for others through knowledge and compassion. A glorious sunrise against the mountains is displayed in the upper half of the pin. This image serves to remind Roseman graduates that although they started their nursing career in the Intermountain West, with every new day, they have the privilege and opportunity to better the lives of others all over the world.
In 1854, Florence Nightingale formed a team of volunteer nurses to care for the soldiers of the Crimean War. It was believed that Miss Nightingale navigated the makeshift hospitals of that war front with the light of a lamp. The lamp was a symbol of the care and devotion Florence Nightingale administered to the sick and injured in the practice of her nursing. After nurses were pinned, Miss Nightingale would light a lamp and pass the flame to each nurse as they said the pledge. Revered as the founder of modern nursing, Miss Nightingale was also known as the Lady with the Lamp who gave hope to those soldiers. Today we carry on this ceremonial tradition, passing of the light.
You guys, this is the fun part. Ellie Absher, pinned by Ryan Absher. Rimple Agarwal, pinned by Kailash Darni. Nicole Alcaraz, pinned by Pamela and Armando Alcaraz. Genesis Amaral, pinned by Bertha and Isaac Amaral. Scout Andrew Chow, pinned by Joshua Andrew Chow. Joshin Bandal, pinned by Kushi Bandal. Taylor Bean, pinned by Carol Bean. Abby Victoria Brickley, pinned by Allison Brickley. Cameron Brady Carruthers, pinned by Sydney Thomas. Rebecca Noreen Collins, pinned by Tina Littlejohn. Tyler Corsi, pinned by Rachel Webster. April Renee Doss, pinned by Chris Nayland. Darlene Laudato Francisco, pinned by Maria Victoria Francisco. Evelyn Maritza Gomez, pinned by Francisco Gomez. Denise Alice Gardado, pinned by Martin Perez. Stephanie Guerra, pinned by Christopher Guerra. Morgan Lynn Hall, pinned by Michael Hall. Pa Chia Her, pinned by Mai Vong and Shua Hare. Shelby J. Johnson, pinned by Susan Kelly and Rick Johnson. Caitlin Branham, pinned by Sean Branham. Leilani Ma, pinned by Brandon Boyd. Brooke Molnar, pinned by Cindy Molnar. Janelle Marie Pinello, pinned by Eric Ortiz. Alejandro Rodriguez Salinas, pinned by Maria and Enrique Rodriguez. Lakeisha Slakowski, pinned by Kolta Norberg. Amanda Lindsay Smith, pinned by Jason Lindsay. Carmen Truong, pinned by Melissa Truong. Mark Tuano, pinned by Susan Tuano. Samantha Warday, pinned by Daniel Jackson and Guy Warday. Robert Wilcia, pinned by Mark Tuano.
Okay, the best part. So if there are any, I'm Professor Jamie York, and we're going to administer the nursing oath. So if there are any nurses in the audience, will you please stand and join us in reciting the oath? Yes, you guys are nurses, so stand on up. This is for you. All right, all nurses, please raise your right hand. In full knowledge, oh, you're going to repeat after me. Sorry. In full knowledge of the obligations I am undertaking, I promise to practice professional nursing with all my skill and the understanding I possess, without regard to race, creed, color, politics, or social status of those entrusted to my care. Sparing no effort to preserve quality of life, alleviate suffering, and to promote health as affirmed by the person. I will respect at all times the dignity and beliefs of the patients under my care, holding in confidence all personal information entrusted to me, and refraining from any action which may endanger life or health. I will endeavor to keep my professional knowledge and skill at the highest level, and to give support and cooperation to all members of the healthcare team. I will do my utmost to honor the International Code of Ethics applied to nursing, and to uphold the integrity of the profession. Great job, nurses.
We're going to start with the presentation of awards now. I'm Professor Stacy Smith. I'm presenting on behalf of the RNPC Scholar. The purpose of the RNPC program is to recruit and train nursing students and current RNs to practice to the full scope of their license in community-based teams. This will ultimately increase access to care while also improving population health for rural and underserved populations. The focus is on chronic disease prevention and treatment and includes substance abuse and mental health conditions. Additionally, students receive training in assuming leadership roles within the healthcare arena and experience collaboration with other healthcare professionals throughout their nursing program. Congratulations to Robert Wilsey. Great job.
Good evening. My name is Professor Bethany Hayward, and I have the honor to talk about the Student Nurses Association tonight. Professor Mon is unable to be here tonight. She sends her regards and apologies for not being here. Founded in 1952, the National Student Nurses Association is a nonprofit organization for students enrolled in nursing programs. It is dedicated to fostering the professional development of nursing students. We have a chapter of Student Nurses Association here at Roseman. This association promotes each member to build their leadership skills and conflict resolution through shared governance and community, with respect for others. Student nurses in SNA make their own decisions based on fiduciary research and historical and current evidence. They are encouraged to take full advantage of their education and to develop their professional leadership skills through collaborating with other members of the healthcare team and providing hands-on care to their clients. The many activities participated in by these students developed continuous, lifelong learning and ethics of the profession. These students are known throughout the community for their hard work and compassion. We are very proud of these students who have demonstrated their integrity, compassion, humanity, and professionalism, and would like to recognize them today for their contributions to the community. As I call your names, please stand to be recognized. Ellen Ashver. Nicole Alcatraz, sorry. Scout Andrew Chow. Taylor Bing. Rebecca Collins. Tyler Corsi. April Doss. Stephanie Guerrera. Leilani Ma. Brooke Molnar. Janelle Panelo. Amanda Smith. And Samantha Warday. Thank you, students.
You guys, I'm so proud of it. Of you guys, you crushed it. We're so excited for you. Good job. So you did graduate. You're graduating during a pandemic. That's amazing. At this time, we would like to recognize the members of the Honor Society. I am the faculty advisor for the Honor Society. Students are eligible for membership as long as they meet requirements on or before the designated due dates. Students will have demonstrated superior academic achievement, academic integrity, and professional leadership potential. The asterisk after a student's name in the program indicates that the student is a member of the Roseman Nursing Honor Society, as do the gold and purple honor cords that members are wearing. So today, as I call your name, please stand. Nicole Alcaraz. Congratulations.
Well, good evening. For those of you who don't know me, my name is Susanna Winslow. I'm the Associate Dean for Academic and Student Affairs on the South Jordan campus. Most of the students here probably know me as the Director of Clinical Resources, and I have the incredible luxury of having seen them on their first day of orientation. And then I had the amazing opportunity to be with them this morning when they took their comp predictor, and I was sweating every bit as much as they were. They promised me that the room was really warm, but I'm not sure that that was really true. So I'm incredibly proud of them. I kind of am behind the scenes now, so I don't get to see them very much, but it's just an amazing opportunity for me to stand up here. And I don't need to remind you parents and family that you should be incredibly proud of these students. They have put in a whole lot of blood, sweat, and tears. Sometimes the tears were in my office, which is totally fine. Sometimes it came across in the email, but they did an amazing job. And Dr. Oxhorn said it very appropriately that you guys totally shredded that comp predictor. I was so proud of all of the results. So please, when you walk out of here, walk out with your head incredibly high, because you should all be very, very proud of yourselves. That's my spiel. Kind of a side note, because it's not part of the script, which most of you know that I don't really go off the script very much. And the other part is I have an amazing job, and I now get to not only announce all of the names, because that's a super fun part, but now I get to talk about the class officers that we have for this cohort, as well as the student awards. At this time, we would like to recognize the cohort class officers, and please stand to be recognized. Ellie Absher, Scout Andrew Chow, April Doss, and Stephanie Gyra. Thank you all very, very much for everything that you've done for us. It is now my privilege to honor a couple of students in the class of 2022. This is the super fun part. These awards are for students who have demonstrated a high level of performance based on criteria established by the college and the university. Nursing faculty nominates students whom they believe have met the criteria, and then the faculty vote to determine which of the nominated students will receive the award. Is the suspense killing you? Drum roll. Who's the drummers out there? Oh, no, wait. Don't go into that. Okay, I'm going to do the Spirit of Nursing Award. We would like to present the Spirit of Nursing Award. This award is reserved for the students who most represent the image of professional nursing. The student selected for this award has demonstrated behaviors that embody caring, compassion, and kindness to their fellow classmates. The student has also demonstrated professional nursing and compassionate care to their patients. This is where I'm going to read notes from the faculty. This student has always been happy, full of energy and positivity. Her bright, oh, that just kind of gave it away. That narrowed it down to what? 3/4 of the students? Her bright, fun personality resonates with her peers, staff, and her patients. She continues to show caring and compassion with each encounter. This student embodies the Spirit of Nursing Award. She is very professional and works incredibly hard. Do you guys have any ideas yet? Okay, I'll keep going then. We have worked together in the lab and have seen her become an excellent nurse. I am so very proud of you, and you will be a phenomenal nurse. This comes from Professor Natalie Mon. Okay, here it comes. Congratulations to Scout Andrew Chow and the Spirit of Nursing. Scout, if you would please come up.
The Dean's Award is presented to the student who has demonstrated leadership abilities, who has excellent communication skills, and is committed to the excellence of the College of Nursing. Student selected for this award by the faculty has outstanding critical thinking abilities, is excellent at nursing skills, exudes leadership with the ability to listen and help others. Disposition is always committed to excellence, works hard to receive top grades, has incredible communication skills, working with her in the lab was a joy. I was trying to give it up. Okay, fine, whatever. She has a great laugh, and people are drawn to her, and will make an amazing nurse. And the faculty are so proud of you. Congratulations, Lakeisha Slagowski. All right, we're going to wrap it up here. We're going to give Lakeisha a minute to walk back. All right, I'd like to share just a few parting words with my graduates since the last time I'll have their attention. The first time was at orientation 18 months ago. So today you are entering the world as a professional nurse, and you represent the future of our profession. And I challenge you to ask yourself each and every day, how should I be, not what should I do? Quite different. Think about your character, your values, and your virtues, your ability to act outstandingly. Your journey of discovery does not end here. Continue to ask yourself in each new challenging situation, how should I be? Okay, I think the lab taught you 5 rights of medication admin. It might be more than that now, I understand that, but I'm old school. But that doesn't fit with my speech, so we're gonna go with 5 today, okay? So that is, always act at the right time regarding the right thing, towards the right person, with the right intention, and in the right way. Now you can go out and be the role model for those you care for and interact with. As you go forth and be fruitful, remember, watch your thoughts, for they become words, and watch your words, for they become actions. Watch your actions, for they become habits, and watch your habits, for they become your character, and watch your character, for it does become your destiny. And I know you guys are gonna act outstandingly out there, and I'm so proud of all of you. So welcome to our profession. This does conclude our ceremony. Thank you all for being here this evening. Couldn't have helped make it a wonderful night. I'd ask all my graduates to stand briefly and turn to your family members and just give them a big round of applause. Thank you, friends and family, loved ones, for all the support, emotional, financial, structural, if you live together. And with that, we are going to have some refreshments in the back here. We're going to proceed on down, and then please join us for the rest of the evening. And cue the music.